Hey everybody, welcome back to the show. We're here today on a brand new Cabral concept. We're going to be talking about and asking the question, is berberine better than pharma drugs? So you probably heard about, of course, all of the blood sugar regulating drugs that are out there, maybe even weight loss drugs, since we've talked about on the show, like Ozempic. If you haven't heard that show and the new weight loss drugs, tune into stevencabral.com/2721 for the show notes today. I will link up those previous shows. We're also going to be talking about what berberine does for cholesterol and the heart, as well as non-fatty liver. So let's dive right into it. If you haven't heard about berberine before, it's been used in traditional Chinese medicine and somewhat in Ayurvedic medicine as well for thousands of years. However, we're now able to extract it and use it at a higher level, typically 500 milligrams and above, to get a clinical effect from it. We'll talk about what those clinical effects may be and if it may apply to you. You can find it in nature in barberry, Oregon grape, and a few others out there. We've actually been using those inside of our practice for about a decade now in our gut health-based protocol. We won't be talking about that as much today, but berberine actually has some positive effects on the gut microbiome. Again, lo and behold, Ayurvedic medicine, traditional Chinese medicine has taught us that for many thousands of years. However, let's start to go over some of these studies and why they may be of interest to you. So the first one is actually out of the Cleveland Clinic. It talks about weight loss. So basically, early research right now shows that in some clinical studies, those people that took berberine for every day for 3 months experienced significant weight loss. So reason is that it has an impact on insulin and glucose. So remember, like, these aren't magic pills. Even if it does come from nature and again synthesized in a lab, it's not magic. What we have to understand is the body becomes imbalanced through certain homeostatic regulating principles. So what I mean by that is that if your body has normal regulation of blood sugar, you're probably not going to get as great of effect as berberine, right? So like if you do have insulin resistance, that means when you eat certain carbohydrates or even high protein based foods and you get a spike in blood sugar, your cells are not as receptive. The cell receptors are not as open to taking in the glucose into the cell. Now the cell still needs glucose, right? It still needs it, still wants it, but it's not able to take it in. Those cell receptors are shut off. So what happens is the pancreas begins to produce more insulin because it keeps getting the signals from the cell that the cells need the glucose to take it in. It's in the bloodstream, but it can't. So it produces more and more insulin. Eventually, one could get type 2 diabetes. So what berberine actually does is it helps with that insulin sensitivity. It allows the cells to reuptake or uptake glucose from the blood as it normally would. That's why carbohydrates aren't the enemy. The enemy is not understanding and looking at the underlying root cause, which is not your fault. But if you go to your doctor and they're just prescribing medications without looking at the underlying root cause, it's not helping you in the long run. They're obviously not trying to hurt you, they're trying to help you, but what they're overlooking is the root cause as to why you became insulin resistant in the first place. So really important that looks at this. Berberine is starting to be referred to as nature's Ozempic. It's nature's weight loss drug. I would go easy there. There's many reasons why people gain weight. We formulated something that's been it's been around now for a couple of years. It's on over 25 scientific studies. It's used by people all over the world. And it looks at all the different reasons for weight gain. I'm not saying you should purchase the product, but look into all the different reasons of weight gain. I have a podcast on that. Obviously, it's completely free. I'll link that up today at stevencabral.com/2721. And the product, and it's actually a system called Fatlossity. So a wild name, but a scientifically based study. And so you can find that as well, stevencabral.com/Fatlossity as well. Again, just look into all the different reasons for weight gain before beginning to use anything to help with that weight loss based reduction. Because again, you want to know the underlying root cause. All right, now let's talk about berberine used for high cholesterol, okay? And really what we're worried about is high LDL without balanced HDL. So we want higher HDL and we don't want too high LDL, which is, again, when we typically refer to cholesterol, and I know I don't want to perpetuate this, but LDL is typically looked at as oxidized cholesterol. It's more bad, right, when it gets built up. And HDL is referred to as more good cholesterol. It's obviously very nuanced. I understand that, but it's still important just to at least put that out there. So there was a 6-month study done. After 6 months of diet and exercise changes, 144 people with high cholesterol, hypercholesterolemia, who were otherwise low risk for cardiovascular disease, were randomized to 500 milligrams of berberine or placebo twice daily for 3 months. Okay, so these people took in 500 milligrams twice a day. So then it was followed by 2 months of a washout consisting of only diet and exercise, and then an additional 3 months of berberine or the placebo. Here's what they found. They found that berberine was able to help the people lose weight, improve their BMI, but when they, and only to the degree of cholesterol reduction in the berberine group. Now, and these were people who basically were diet and exercise not responders, right? Okay, so now when they stopped the berberine, the LDL actually went back up and the HDL went back down, right? And you want the reverse of this. They put them then back on the berberine and they actually saw then the same results. LDL went down, berberine went up. And so I'm going to link that up for you, that study as well. But that was quite interesting. So if you're not responding to so-called diet and exercise, I actually believe that most people just aren't on the right, believe it or not, diet or exercise. Like, people don't respond to diet or exercise. Okay, well, like, what diet are they on? Because there's, 10,000 diets that you could choose from now in the popular culture. So I think we have to be careful saying that diet and exercise doesn't work alone, but nevertheless, berberine was helpful. So that's 500 milligrams twice a day. Again, I'm not giving you medical advice, medical treatment plan, medical diagnosis, or anything medically related on the podcast, of course. All right, now let's look at another one. This is really important for blood sugar and lipids in people already with type 2 diabetes. So we talked about people that were pre-diabetes with insulin resistance and weight gain, it helped. It talked about people with higher cholesterol, bad cholesterol, and lower good cholesterol, it helped. Now let's take a look at a 3-month clinical study. 116 subjects. I know it's not a ton of people. I agree with that. With type 2 diabetes and dyslipidemia, so typically higher LDL, lower HDL, maybe even high triglycerides. That was not stated though. They received, again, 500 milligrams twice a day or 1 gram, which is the same thing, of berberine daily or placebo. Statistically significant decreases were seen in the berberine group in fasting and postprandial glucose levels, hemoglobin A1C, triglycerides, and total and LDL cholesterol. There you go. Triglycerides were tested as well. All right, this is really interesting. So what does this mean? So basically, they gave a group of people with type 2 diabetes and dysregulated lipids. So they had high LDL and they even had high triglycerides, which is a little something different produced by the liver. Not ideal though. You don't want to produce high levels of triglycerides. Typically, you don't want to produce over 90 on a blood work, but we try to keep people around 75, maybe even a little bit less. Okay, so let's take a look at this. Hemoglobin A1C is basically the status of glucose averaged over 3 months, and we're talking about then total cholesterol and LDL. And fasting glucose is a really important marker. You should be below, ideally, at 95, but definitely for type 2 diabetes, below a 126. Postprandial glucose is how high your blood sugar gets after a meal. Now, with 1 gram of berberine, it improved all of those levels: LDL, cholesterol, total cholesterol, triglycerides, hemoglobin A1C, and glucose. So it basically lowered all 5 of those. Pretty impressive, right? So again, I always say look for the underlying root cause, but in this case, maybe look towards berberine as well as a supplemental adjunct while you're working on finding the underlying root cause, and then I think you can reduce your berberine and or come off of it. All right, another 3-month study. This time, again, only 36 people. I know it's small, but I still want to bring you the actual research. 36 people, newly diagnosed type 2 diabetes. They were given 500 milligrams 3 times daily of berberine, or metformin. So metformin is a drug to help lower blood sugar, regulate blood sugar, improve insulin sensitivity, etc. Significant improvements in glucose metabolism, fasting and postprandial, that just means after you eat, glucose levels, as well as hemoglobin A1C, were seen in both groups. Berberine resulted in a decrease of hemoglobin A1C of about 9.47, plus or minus 0.65, to 7.48, while berberine was more effective than metformin at decreasing total cholesterol. Pretty impressive, right? So when we're looking at what could be a possible solution, again, I'm not giving you medical advice, but if you're someone using metformin, or you're using one of these other weight loss drugs like Ozempic, you may want to look at more of a natural substance first, such as berberine. Again, not giving you any medical advice. You want to talk to your medical doctor as well as maybe your natural health practitioner, but it's worth exploring. For lowering cholesterol, right, that would be more of a statin. For weight loss, that would be more something like Ozempic or the other weight loss drugs now in that category, or something like metformin for blood sugar regulating. Again, not giving you medical advice, but worth exploring. This one was 1,500 milligrams, 500 milligrams 3 times a day. The side effects typically for berberine are nausea or cramping or gas or bloating. It's typically a digestive-based issue. But pregnant women, nursing women should not use berberine. I just want to state that as well. There can be some side effects with the unborn child. So hopefully this was helpful. I'm going to link up all 5 of those clinical studies here today. Just head on over to stevencabral.com/2721 for the 3 big takeaways, plus the 5 studies. I can't link up any different supplemental berberine. That's illegal when talking about diseases on a podcast. But I know that you'll be able to find berberine, and everything that I recommend in my practice is simply at stevencabral.com/shop. Hopefully that's helpful. Take care, everybody. Have an amazing rest of the day. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.